Today we'll start our next journey of learning medicine, and it is about the management of hypothyroidism. Very common in our clinical practice. We see people are coming with thyroid disorder. We know this is a very important organ that is located in our throat region. Okay, and this thyroid problem is getting increasing day by day nowadays. Today we will not learn excess of hypothyroidism pathophysiology or how hypothyroidism is produced and its different ways in presentation, different features. Today I am directly going into the management, so it will be a small video but very much effective for learning hypothyroidism. So hypothyroidism, it's an endocrine disorder where you will see the amount of thyroid level will be reduced or decreased in the body in response to the age or in another some clinical stage like pregnancy or otherwise, but mostly age related reduction is there. And this thyroid level we will assess by investigation like TSH level, T3 level, T4 level, FT3, FT4. Okay, we do, but most importantly if we only do TSH level and FT4, that will give us an important idea about the thyroid status of the body. So if we see a person is having the thyroid level, TSH level is very much increased, and FT4 is reduced, so in this case we can say that is the primary or that is the specifically is a hypothyroidism. Okay, so now in hypothyroid problem due to any cause, if you see this condition, you will start drug that is the levothyroxine. Okay, this is the levothyroxine. It is the main drug that we should start in our treatment, levothyroxine. So a question will come, how we will start this. Levothyroxine should be started in our book Davidson. There is dose 1.6 microgram per day. It is per microgram per kg, sorry, it's a per kg requirement of the body. So it has been said that in 70 kg person you daily may need 100 microgram of this drug as replacement, as purely there is no thyroid in your body, you need this replacement. Okay, now in young adults, in young patients, you should start with full doses, but keep in mind, this older patients or patient having cardiac issues, ischemic heart disease, those patients you should start with low dose. You can start with I think 25 microgram per day, then you can slowly increase the dose. Okay, now you should wait for 10 weeks for after starting treatment for next TSH level. Our main goal of our treatment is to stabilize these TSH levels. Your FT4 maybe is slightly borderline or maybe in increased side you may found, because this FT4 is turns into FT3 which mainly acts in the tissue level. So it's not a big deal, you have to normalize the TSH level. So after normalizing the TSH level in every 10 weeks, you can assess the dosing schedule or dosing level, then you can go stabilize to a specific dose or a specific level. Okay, Now when there is stabilization occurs in yearly you will do that TSH level. Okay, you will see the TSH level, and then yearly uh, to specify the level of treatment is perfectly going on or not. So this is very important. So whatever happen, you give so much. Why we are very much careful about older patient or heart disease? Because if we are giving the thyroxine or levothyroxine so much, it may cause atrial fibrillation can occur. Okay, this is the one issue. Or in a cardiac arrhythmia can develop. Sometimes there are, in some study it is saying that to stay start combination drug like T3 with T4 combining. We can use these two drug can be started in some study, in some ways that has been tested. But the main in practical way, it has been seen only to use this levothyroxine. And you should only, as I have mentioned, in 10 weekly you should assess the functional level, and then go for stabilization of the level. And in some condition, specifically in pregnancy, what should we do? In pregnancy there is increased need of the thyroid, so 30 to 50% increase in the dose. Whatever dose you are going on, in this condition you should increase the 30 to 50% of the dose. Okay, so if we increase it, then it has been seen that the patient will feel good, and her baby in pregnancy, if we don't increase it, or there is decrease in the thyroid level, then the baby may be develop the cretinism, or cretin baby may be produced, she may give birth to cretin baby. That is neurological developmental disorder. Okay, so that should be keep in mind. In older patient, another state, that is a myxedema. It's a clinical condition usually seen in older patient, where it is an emergency. There is acute failure of the thyroid function, and T4 T3 all level are gone. So how you will treat this patient? In this patient you must give injectable. So you directly use T3 here, which is known as leothyronine. You should give it IV 20 microgram. Okay, and you should further use it, follow up for 3 times daily. This should be start dose, then 3 times daily. And after 24 to 48 hours, if patient is stabilized, you can start the oral form of levothyroxine. Okay, and also patient developed hypothermia, you should give the treatment of the hypothermia. It is the warming of the patient, gradual warming of the patient is very much important. But mortality rate is very much high in these cases, but you should keep in mind the the gradual warming of the patient. So these are the things. And if this myxedema is developed due to pituitary problem or hypothalamic disorder, then there is other important hormone like reduction of the cortisol can be found. So you should also needed to give injectable hydrocortisone to the patient. Okay, 3 times daily you should give those things, and then you can send the blood sample for management. So guys, that's it. Normally in hypothyroidism we will give the thyroxine, then we'll assess the status to stabilize the dose. In pregnancy you should increase the dose. In older patient, cardiac patient, we should start from the very much low dose to avoid any kind of problems. And in myxedemus condition, which is medical emergency, we should give in intravenous IV dose. Okay, thank you very much for listening my video. I hope you are learning here more. Thank you very much.